It's new and untested on humans, but Canadian scientists believe it's worth a shot. Canada is offering to donate an experimental vaccine for use in African countries ravaged by Ebola. CBC health reporter Cass Rusi joins us now with the latest. Cass?
Wendy, Canada has reached out to the World Health Organization tonight, offering up to 1,000 doses of an experimental Ebola vaccine that's currently being manufactured at the National Microbiology Lab in Winnipeg. All of this on the same day that the WHO said it would endorse experimental drugs in the fight against this deadly virus.
We had 3 deaths, the one that died previously.
Faced with a global health emergency, the World Health Organization says it's not only ethical to okay the use of untested Ebola drugs, there's also a moral obligation to do so.
There was unanimous agreement among the experts that in the special circumstances of this Ebola outbreak, it is ethical to offer unregistered interventions as potential treatments or prevention.
So far, only a handful of people have received the experimental drugs, including 2 Americans, foreign aid workers who contracted the deadly virus while caring for Ebola victims in Liberia. They're still in a U.S. hospital. A Spanish priest also infected in Liberia was reportedly treated with the same experimental drug but died earlier today. This Canadian doctor was part of an ethics panel advising the WHO.
Now, what needs to be put in place is we have to sort of make sure people aren't overly optimistic. Just because something works in a monkey model doesn't translate necessarily into effectiveness or efficacy in humans.
Researchers at the National Microbiology Lab in Winnipeg helped develop much of that untested drug. But today, the U.S. manufacturer of the drug said that its available supply has been exhausted. With a dwindling supply, this medical ethics professor says too much focus is being placed on drugs rather than prevention.
My preference would have been for the WHO and Western countries to support prevention efforts, to support efforts to contain the spread of the disease.
And part of that prevention campaign could be that experimental Ebola vaccine that Canada is offering up tonight. Wendy.
Thanks so much, Cass. Cass Rusi.